it'd be interesting to see too, because it seems like there's potentially two factors that could be, at least the evidence we have now, two factors indicating why the tonsils could be lowered. One of them is decreased CSF because of a dural leak that could be corrected. But another one, potentially, that ligaments and soft tissue holding the brain and making sure it doesn't come down could be torn. So I think, what are your thoughts on some research that could be done, again, in these positions with torn apical ligaments or alar ligaments, or these things that could measure the tonsillar level in different positions and finding whether, kind of differentiating which one it could be and why those tonsils are down. What are your thoughts on doing that as research?
So what Dr. Rosa has done, and I think he's one of the only people that has worked hand in hand with Dr. Ray Damadian, the inventor of the upright MRI. But what he's done is he's developed a collar that goes around the neck that, with Dr. Damadian, they have developed a collar and a imaging modality for the upright MRIs where they look so minutely. You can't do this with other machines because you can't, so you have to be upright. So that cuts it down to a certain amount. I think there's like 20 of these machines in the country, and every single machine should be an upright MRI machine, in my opinion. And, we should all really push for upright MRI imaging, because any problem that you have in your spine or your body, it's going to show up in a more gravity correct way on an upright MRI, no matter what your problem is. And then what they've done is they've taken this collar, they've developed a collar that looks specifically at the alar ligaments, at the apical ligaments, at the, at all the other ligaments that are there, the handful of other ligaments that make up the glue that holds the upper neck together. And honestly, I don't think anyone else is really doing that or has ever done that. And I think it's quite hard to do, and you need very specific imaging for it. So I think that to answer your question, Kevin, I think that's actually quite hard to do, and you need specific protocols and specific tools to do that. Because a motion x-ray a motion x-ray shows you the bones, but it doesn't show you the ligaments. You can guess what ligaments might be injured, but you can't see which bones. Or you can guess which bones might be injured, but you can't see which ligaments. Does that make sense?
Yeah, for sure.
Okay.
Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support.